Healthcare is an investment, Madam Speaker. And as a country and as a people, we must pivot in our thinking to ensure that our investments have the greatest return in ensuring a positive, resilient future for generations to come.
The ministry with oversight continues to make the investments to build out Jamaica's health infrastructure and promote behavioral practices that support wellness. In the mission to review, reform, and renew public health, the prescription for achieving sustainable health financing is being explored. Economist and Executive Director of CARPI, Dr. Damien King, will lead the process for this healthcare financing review.
It is time to restructure the health system to achieve a more sustainable financing mechanism and to do so in a way that ensures efficiency and accountability of existing expenditure, as well as a greater proportional contribution to reflect the increased demands on the system.
The principle of primordial intervention, that is, to prevent the risk factors of ill health, is a fundamental part of government's approach to public health.
This is what we talk about when we talk about prevention. We must make the link between the cost of sickness and the need to avoid or at least delay sickness.
In the 2022-2023 fiscal year, this will be seen in various interventions to promote a healthier diet, adequate exercise, and regular health checkups. The Jamaica Moves in Schools program will continue to be rolled out, getting more children involved. Advocacy around front-of-package labeling will be stepped up to protect consumer rights to know what's in their food. This preventative strategy also involves the continued enforcement of the program to restrict sugary drinks in schools. The Health Ministry will partner with its education counterpart on a policy proposal for guiding school cafeterias on preparing healthier options for children.
We must help our children to develop healthier habits, and the school environment is the best place to start.
The elimination of industrial trans fat or trans fatty acids from our food system is also being pursued through dialogue with manufacturers and distributors. And the new tobacco legislation is to go before Parliament this year.
Included in the recommendations that will be captured in the new legislation, restrictions on marketing tobacco products, prohibiting the sale of tobacco products to children, and restrictions on the development of advertisements targeting children within our society. Expansion of the prohibitions to include use of electronic nicotine delivery system such as e-cigarettes in public spaces.
Other key features include support for reducing dependence and a fixed penalty regime, as well as graduated penalties. The document to guide primary healthcare reform for Jamaica 2021 to 2030 has been tabled in Parliament. This is to ensure delivery of demographic-based and individual care services, as well as access to those services. An e-health strategy is being implemented as part of the effort to revolutionize patient care using technology.
We have commenced. The cable and wireless were the recipients of a competitive bidding process. The ICT managed network services that they are now implementing in 100 health centers.
A chronic care model is also currently being designed that will be supported by the e-health strategy. The build-out of major health infrastructure will progress this year, with government's commitment of over $5 billion in investment. These include Cornwall Regional Hospital, where work has commenced on Phase 2B, which is expected to cost $1.7 billion. Cabinet has already given approval to move forward with the implementation of Phase 3.
We will see that final phase leading to the restoration and reopening of the hospital.
Government is also spending $100 million this year to complete preparatory work for the construction of the 250-bed Western Children and Adolescent Hospital. Designs for a 6-story towers to be constructed at the University Hospital of the West Indies is being done.
This year we have allocated resources to relocate the ring road and to clear the spot where the construction will begin. And hopefully over that time, the designs would have been completed so we can break ground for next year.
The $50 million IDB project to construct the new Spanish Town Hospital will be put to tender. with construction expected to begin later this fiscal year.
Facility will boast an accident and emergency wing with ambulatory and ambulance bay, triage and consulting rooms, patient wards, among other things, lounge and lunch areas, a radiology department, a pharmacy and outpatient department, a surgical floor, patient wards, together with a basement area that includes staff parking, as well as a sky bridge.
A $4 billion program will begin to replace all diagnostic equipment in hospitals over 2 years.
All Type A facilities having an MRI and CT scan machine, that is one. All Type B facilities have a CT scan machine, and all hospitals having an ultrasound machine and X-ray machine, just to name the critical ones, Madam Speaker.
Meanwhile, public sensitization on the patient Charter of Rights and Responsibilities will continue, while the public complaints mechanism will be reintroduced with a new feature.
We will engage the services of a BPO firm to manage all toll-free lines to receive and track complaints and provide the reports to the complaints mechanism that will also be strengthened to follow up, monitor, and report directly either to the Permanent Secretary's office or to my office as Minister.
A new mental wellness program, being coordinated by Senator Dr. Sophia Longmore, is targeting mental health recovery effort from the side effects of COVID-19 through psychosocial support in communities and schools.
There will be a community outreach, visit persons, listen to them. If they have issues, encourage the kids to go back to school, provide guidance if there are concerns, all the way up to having an appointment with a psychiatrist, if that is required. And we're going to be providing a mechanism for more specialist care in the public and private sector for persons with more serious mental health challenges.
1,000 surgeries planned over 10 months under a special intervention called Code Care will clear up most, if not all, backlogs caused by delays due to COVID-19.
We're going to be working with the diaspora, and that discussion has started, of healthcare professionals who visit Jamaica for special surgery sessions to provide a more efficient arrangement and access to hospital facilities and target elective surgeries with the longest wait.
In support of this, $100 million will be used to repair operating theaters, while partnerships with private health facilities will provide surgery and recovery spaces to augment the existing facilities. These are just a few of the ways the Ministry of Health and Wellness plans to secure the health of the population this financial year.